Welcome back to part 2 of our conversation with Dr. Khadija. If you haven't watched part 1 yet, please press the link up here because this conversation builds up from that one. Thank you.
So what signs to parents, let's make this as layman as possible, what signs would suggest that a child may need a medical review or may need a blood test?
Okay, very good question.
Yeah.
So now when we look at the signs to look for, we're looking for also, when we look at biological, when we look at the medical aspect of it, is, are there sudden changes, right? So say therapy was working, but now it's no longer working. There's regression. All of a sudden there's regression. So when we look at these things, these are the things that we have to look for when it comes to behaviorally. Is my child having more behaviors that challenge than they used to? Is my child just suddenly very moody, very irritable? Is my child having these micro sleeps? Are they napping more than they used to nap? So say your child wasn't napping during the day and now they're taking a nap, even one nap during the day. So why is my child suddenly, and especially older children, why are they suddenly napping during the day? Is my child waking up tired? So if you've had 10 hours of sleep, you shouldn't be waking up tired, right? So is my child waking up tired? Is my child sort of holding a different part of their body? Are they sort of pulling on their ears? Are they, are they putting things in their mouth more often than they used to? So when you don't, remember that children can't communicate their physical symptoms as well as an adult with. So this is for children in general, and even more so for children who haven't developed verbal communication or speaking communication. Another aspect that is key here is one of our senses, which is interoception. Does the child understand what they're feeling, right? So a child that doesn't understand what they're feeling would just scream and shout, right? But you will see that whenever you have pain, as you can localize pain. So what I mean by localized pain is an adult will tell you, I have pain here, or I have pain here. A child would just pull at it because they want to remove that pain, just remove it. And it's also part of gate theory as well, that if I do this, I'll feel less pain here, because that's the gate theory of pain, is that if you open up another gate of pain, it will reduce the pain on the other side.
And I do that. I do that for dentist.
Exactly.
When
you see?
I start pinching myself so I can put my attention on here and not feel this.
Exactly. That's it. That's it. So if a child is just scratching, they've never done this before, and they're just scratching at a different area, the pain might not even be there. It might be in a different place. And so if your child is just scratching at themselves, putting things in their mouth, they're having gum or a toothache, and so they're putting things in their mouth trying to get rid of that pain. These are the signs that you need to look for. Check on their stool. Look in the toilet, check on their stool. I know sometimes you might some people are grossed out by it, but as a parent, check your child's stool, because they might not know what's going on. They might not think they're constipated. So even older children, I always encourage parents to check the child's stool. If they're coming in with a tummy pain complaint and the child says, no, my stool is not hard, no, it's okay. And then when I tell the parent to, maybe the child doesn't understand what hard may be or what soft may be or what's possibly normal and not normal. Because if stool is hard, you might think that that's normal for you because you don't know any better, right? So always tell parents to check. If check whatever comes out.
Very important. Important.
Right?
Important.
It's so important. It's so important. So these are the key aspects. When your child is going to sleep, just have a little pop in. In the middle of the night, if you're still awake, have a little check-in. Just look, is my child sound asleep? Is their mouth open? Are they tossing and turning? Did they wake up in the middle of the night to go to the bathroom? During the day, is my child craving a lot of sweets? Is my child craving high calorie and sweets? What is that? And craving can be a sign of something else. So sweet craving can even be a sign of sleep deprivation. It can be a problem with screen time as well, believe it or not. So these kind of subtle changes in behavior that you might not think about, but if I tell you to look for it, and then you start to notice it. Sometimes the brain blocks out these subtle things because they seem unimportant. But when I actually tell parents, just I'll give them a list of things. Like, can you just look at this, and our next follow-up, let's see what you have found, or if there's anything that you notice. And when they start to really focus and I guide them on what they need to look for, more often than not, they will come back with something.
So following on from the vitamins, should parents supplement themselves, or should it be a bit more, say, medically guided?
So now this is the thing. If you're asking if we should just give a multivitamin to a child, no. Actually, I don't believe in giving every child a multivitamin. It's unnecessary. The thing is, because we have vitamins that we need a little bit more of, and vitamins and minerals that we need a little less of. So what you're eating could give you enough of those micronutrients and some of those vitamins, depending on how much you eat in the day and what your diet consists of, basically. And so this is why we work closely with the dietitians as well. We partner up with them, and so to make sure that we're able to look at the food and what's being eaten and how much you're getting from there, right? So multivitamins. Multivitamins, I do not believe in giving a child just a standard multivitamin and going along your way. It really depends. Does this child really need it or not? So nutritional wise, are they getting what they need from their diets? So now we come into picky eating and restricted diets, right? So this is different. If you do have a picky eater, first and foremost, yes, they will, more often than not, they will need to be supplemented because they have restricted diets. They are unable to reach their quotas of vitamins and minerals for the day. But for these children, it's always best to see where the levels are. So if I give you a standard multivitamin and I say, here, take your multivitamin and let's wait and watch, that is not a standard. The amount of vitamins inside a particular multivitamin is not enough to treat. So we have maintenance doses and we have treatment doses. So our treatment doses are higher, much higher. It's based on body weight and age. And so we need to make sure that we're giving treatment doses and not just maintenance doses. And to be honest, some of the multivitamins, depending on what it is, have lower than maintenance doses even. So it's just not enough. So yes, you can give a multivitamin if you want. Is it going to benefit? No. If we don't know if we're not targeting the vitamins that are the big vitamins, the ones that are really important structurally, and we look at the clinical signs and symptoms as well, and sort of bring that together and decide which tests or which vitamins need to be tested depending on the symptoms that we see. And from there, take it and give treatment doses over a specific period of time. And now the period of time becomes a difference as well, because say something for iron, depending on how much we're giving, we'll treat for about 2 to 3 months. And then for vitamin D, again, for 2 to 3 months, we'll do the treatment and repeat the levels. Okay. And now, say if I just give you a multivitamin, how long am I going to continue this multivitamin for? Is it for forever? Is it that we're going to take this multivitamin
for our lives?
Until when? So when we have exact numbers, we're able to target treatment and know how long our treatment will go for.
It's more targeted.
Exactly. So you know what to target and how long you're going to give it for. Because again, compliance becomes an issue as well. Because if you're going to be taking a multivitamin for about 6 months, after some time, giving your child that multivitamin is going to become tiring, right? And another aspect is the picky eating. Why is this child picky eating? Okay, I can supplement you, I can give you the multivitamins, but why is this child picky eating? We need to fix that first. We need to help the child with that first, and then at the same time optimize the body. So, self-medicating, even with vitamins, it creates more issues. It creates a lot of issues and a lot of questions, and sometimes it's just redundant and unnecessary. So, and again, I don't want to give parents a lot of things to give their children. Unless it's going to be effective, I'm not going to give it to you. So I need to know that I'm targeting something and I'm treating it and I'm efficient in treating it, and then we get the results. Because if I just do it plainly and like, oh, here, take your multivitamin, be on your way,
It's not gonna
you're gonna come back after about 2 months and be like nothing changed.
Yeah, it's not gonna help.
So
it's not gonna help.
it's not worth
Yeah,
it.
so that's quite important because now we've focused on a bit more on picky eating. So we can kind of make the conclusion that picky eating or restricted diets can actually affect the child's therapy progress.
Yes.
That's another loophole that kind of just comes back on itself, right? Because if they're not getting the nutrients that they need to be able to attack the situation the best that they can,
Exactly.
then how can they be as efficient as they can be in the therapy room?
Exactly.
Yeah.
And we know that children who have any kind of developmental difference, that more often than not, they have feeding issues.
Yeah.
And so feeding issues is a really big part of it here. And like you said, it comes back on itself. So we have the feeding issue, we get the nutritional issue, and it's just worsening everything after that.
Yeah.
Saying and the thing I despise about when you tell someone that a child has picky eating, firstly they say it's just behavioral, the child will get over it. No, I'm sorry, that's not how it works. No, it's not simply behavioral, and saying the child will eat when they get hungry is not enough anymore. It's not enough, and it's unacceptable for anyone to say when the child is hungry they're gonna eat, because believe me, from personal experience and experience in the with parents coming into the clinics, believe me, that child will not eat. They will go hungry and they will not eat. And especially in conditions like AFRID.
Yeah.
Saying the child will eat when they're hungry, anyone that tells you that, run away, run far away, it's not enough anymore. It's not enough to say
that's quite important. So at what point does picky eating become a problem big enough that parents should seek help for?
Honestly, it doesn't have to be a big problem for you to seek help for picky eating. If you feel your child doesn't have a varied diet or a diverse diet, or seems like they have a very restricted diet at any age, come in and let's address it, right? And at different ages, we address it differently.
That makes more sense. So now we've touched on how restricted eating affects energy, it affects focus, it affects attention. So the moment is picky eating is food and nutrition is quite a big baseline into.
Exactly.
It's a big foundational source of part of life, right?
I mean, if I'm gonna come in here hungry and try to talk to you, I'm not going to be able to focus on anything you're saying. I'm just going to be thinking of how hungry I am, and then my energy is going to go low. I'm going to be irritable. I'm not really going to be able to hear anything you're saying or accept anything you're saying. So my perspective or how I'm receiving your information will change as well. I will be a lot more sensitive to it. So I won't be as open-minded to change or accepting information or the environment as much as I would be if I was calm, if I was full, if I slept well, if I'm regulated. So it's different.
It's different. Amazing. So following up from that even more, how can constipation or reflux is quite an important one, or gut behavior affect behavior regulation? Does it show up as challenging behaviors, essentially? If I've constantly got reflux and I've constantly got constipation, would I be more susceptible to being less regulated and in turn having more, say, behavioral problems in children?
Definitely. So when they say, and I'm so happy that the gut is becoming more and more of a big player here, that it's coming to the forefront now.
It's coming to light.
I mean, this is an organ in your body that extends from top to bottom. It's a huge organ in your body, and now we're starting to bring to light or shed light on this, that the gut is the second brain. Your what's thought of as only brain chemicals or brain hormones, the serotonin, the dopamine, the biggest amount of serotonin that's secreted is from the gut. It's from the gut. So again, the gut is the forefront. It's got so many nerve and sensitive nerve innovations when it comes to irritation and pain, that when you have constipation and reflux, it's pain. You're feeling pain. And so that will make you very irritable, especially for a child. A child is feeling pain. They don't know how to, how to express that, how to regulate that emotion of, okay, I have pain. They'll just, they might just be very irritable, upset, not willing to do anything, not willing to accept anything. So, and pain can show up in multiple ways. So things like reflux. Reflux may happen after a meal. So when the stomach is full and distended, and then that reflux can happen after that or just soon after that. And so this might lead to poor appetite in a child, because a child will say, oh, I'm feeling uncomfortable after I eat, so I'm going to associate eating with discomfort and I'm going to stop eating. So that will lead to the poor appetite. Reflux is not just that heartburn feeling that you feel. And this is really a misconception that if you feel the heartburn, that is reflux. Reflux can feel like chest pain. So even chest pain, and I have a lot of children coming in with this recurrent cough and chest pain. And then as we dig deeper, of course, you have to rule out the sinister things. But at the end, after all this, thorough workup, and we find that it's reflux. And reflux happens at night as well. So reflux can happen at night and cause sleep disturbances. And then it's a whole cycle after that, right? So all of these things can really affect, especially the gut, because there's so many things that can go on in the gut. The gut is for absorption, the gut is for excretion, the gut is for, there is so much that goes on to the gut that bringing it to the forefront, that things like constipation and reflux can cause irritability and dysregulation. It is huge.
It's huge.
It is so huge. And we really need to take these into consideration. It should be one of your automatic questions. How is your child spelled? Are they feeling any symptoms of this? So, and I always tell parents, and I always tell other physicians as well, it's not enough to ask the superficial questions anymore. You have to really dig deep into the questions, because if I ask you, oh, do you feel that burning sensation here? No reflux, that's it, move on. Not all children present in the same way.
So that's
Are you having any chest pain? Are you feeling this pain when you're sleeping? What's going on with this? So you really need to ask targeted questions around that, and not just heartburn. No, move on. You're not constipated. Okay, move on. It's not enough anymore.
So what signs can parents look for with children who have gut discomfort and reflux? How can they know when to elevate the problem and when to see someone like you?
Okay, so again, the obvious and the big ones will obviously be if they're complaining of tummy pain, you're going to go ahead and get that checked out. So anything like tummy pain, of course, if your child is complaining of chest pain, they're going to come in and the parents are going to be like, my child is having chest pain, I'm worried. So those are usually the big ones. The younger ones will have a little bit of spit up, or they may be vomiting. So that could be a sign of reflux as well. That type of spit up and vomiting we usually see in the infant stage and not necessarily in the older one, because usually in the infants, the muscles around the stomach are relatively weak than older children and adults. So at that stage, it's coming all the way up. But as they get older, those muscles are tight enough in most children and adults, and so we won't see it physically come up, but we'll see the discomfort, and mostly the chest discomfort, mainly on the upper side of the tummy and the chest as well. So we'll see that discomfort that they're feeling, and these will happen at particular times. So possibly around eating. So whenever a child is complaining of pain or you see they're irritable, look at how many hours. Is it before the meal? Is it during the meal? Is it after the meal? How long after the meal are they having these, are they complaining of this, of pain, right? And then we go on the other side of it is the child is very irritable. The child is irritable, squatting, sitting, holding, crossing their legs. So this could be a sign that they're trying to withhold, and that usually we see with constipation.
And that's important for children who are non-verbal, right? Because not all children can explain verbally or communicate verbally, like, this is the problem, my tummy hurts, my chest hurts. So you have to look at these physical signs as well.
Exactly.
Right?
100%. And that's the basics, that's the bread and butter of pediatrics, is that we have to look at those non-verbal, non-speaking cues and those behavioral cues, because more often than not, we are getting children that really can't explain what's going on, and we just got to figure it out.
Exactly.
And that's why it's so hard, because you really have to sort of think, okay, this system is connected to this system and this is connected to this. So it's a lot of thinking, because they're not able to explain it.
It's not as black and white as you think it is, no? No, it's not.
Really
It's not. You're basically a detective, honestly.
Exactly. It's detective work, 100%.
Work,
It is detective work, and we need to stop looking at the surface now and dig deeper, right? Because we're finding that the more we just keep it superficial, at later stages and long term, we're seeing the effects. So all of these things, you're not going to see the immediate effect, you'll see the effects later on.
That's so true. Okay, so we've touched a lot on food, we've touched a lot on nutrition, we've touched on sleep. I think we've got amazing foundational knowledge of everything that goes outside of therapy room, essentially, right?
Exactly.
Yeah, because not everything happens in the therapy room, right? It's all about what happens during the day, the week, the whole life of which is amazing. So, as a closing question, what would you say to parents whose child is attending therapy but they're not making progress?
Okay. So parents play a really huge role here. The family is the center of everything we do. The parents spend the most time with this child, so they know the child better than anyone. Whenever a parent comes with a concern or a complaint, I take it very seriously. It's not about what I see or what I hear in that moment. That that 1 hour that I see a child is not enough for me to know that child. So parents, you know your child best, right? And so I tell parents, just look for those behaviors, because ask yourself these questions. Is my child calm? Is my child's feeding and nutrition good? Is it my perspective of, or my idea, or is it like the family diet? Is it like my diet? Is, depending on the age, of course. Is my child getting that nourishment that they need? Is my child sleeping well? Again, we've touched upon that. It's not about the quantity, it's about the quality, right? So is my child sleeping well? Is my child regulated? Is my child having more and more behaviors that challenge than usual? Is this out of the ordinary for my child? A parent's intuition is above everything else. I promise you, I get parents coming in and saying, I feel there's something wrong. Something is going on, and I just can't tell what. And then they'll give you one clue, and then you spread out from there, right? And so your intuition trumps everything. So ask yourself these questions. Is my child calm? Is my child regulated? Is my child sleeping well? Is my child eating well? Right? Does my child have the energy that they need for the day, or to get what they need to get done for the day? And I promise you, by answering these questions, you already figured out,
you're deciphering it yourself,
what you need what needs to be done, and your approach completely changes depending on the answers to those.
That's amazing. So if parents and therapists remember only one thing from this podcast, from this discussion, from today's discussion, what would you want that to be?
Ooh, that is such a hard question.
I know. Or one main closing statement to say something that expands the child's development outside of the therapy room, essentially.
I think it would be, look at things from different lenses. If there's one thing I want parents, therapists, doctors, everyone, if there's one thing that because I've been through that journey myself of looking at things through different lenses, right, and different perspectives. If there's anything, look at the bigger picture. Look beyond what's in front of you, because there are so many things that affect this little human being in front of you. There's so many things, there's so many factors. Just widen your view. Do not have that tunnel vision. Widen the view. If you don't have the expertise on it, find the expert that can help you with this. So if there's one word here, towards widen.
But widen your perspective, widen your lens. Yeah, I think that's brilliant. So thank you so much, Dr. Khadija. This has been such an important and valuable discussion because it reminds us that therapy works best when we look at the whole child. We look at it holistically. A child's attention and behavior and communication, learning, emotional regulation are separate from physical well-being.
Exactly.
Right. So everything that we talked about today regarding sleep and gut discomfort and pain and any sort of physiological regulation can all affect how a child is ready for therapy. So for parents listening, if your child is attending therapy but still struggling to engage, or you're seeing problems with the progress, it may be worth looking beyond the therapy room and contacting Dr. Khadija for seeing it from a different lens, like how we said. So thank you for watching. Please like and subscribe. Don't forget to visit Dr. Khadija's Instagram page. It will be tagged in the description below. And thank you so much. Thank you for your time.
Thank you so much for inviting me. It was lovely.
It was amazing.
Thank you.